really proud to be locally owned and operated and being part of the community. I think community pharmacy is growing and changing very rapidly. I think the challenge is to stay with the changes and make the most of the opportunities that are presented, building a sustainable future and one that meets the community's needs will be our ongoing challenge.
Australian National Field Days is an agricultural rural field day based at the Boronor site just outside of Orange. So last year we took a stand. We were part of a small health precinct. So that was really good because it was going out somewhere different. The pharmacy doesn't normally go, spending 3 days there providing information to people. So it wasn't about selling anything, it was raising awareness about particular diseases and what pharmacy can do for people with those.
Here at Priceline Pharmacy Maryborough, we provide a range of professional services to our mainly elderly clientele. One gap that we found was in foot care. There was a shortage of podiatrists, so we trained up a nurse who now has a separate room with a leather recliner, and our elderly people love it.
We consider ourselves to be the future of what pharmacy should be, rather than spiralling down a price-driven path. Developed quite a range of professional services. One of the main ones we've been involved in the last 5 or 6 years is in sleep apnea. There's no one doing it, no one within sort of 100 kilometres. Have a high demand for medical certificates, as it's a 4-week waiting period to see a local doctor in town. We're the most accessible health professionals there is, and there's no debate about that whatsoever. It's quite common for a customer to come in, look, we came in to see you because we know that you know what you're talking about.
Broken Hill has one of the highest obesity levels, the poorest health in Australia. So the logistics of servicing a quarter of New South Wales up to the Queensland border, to the South Australian border and down to the Victorian border is huge. There's the opportunity to work with other health services, to do community talks and to be a much more important part of the community than just purely your role as a pharmacist. I've done home medication reviews often in people's front yards under the front tree on a 42-degree day. So in all, I guess we're an integral part of the local community.